Honey is often seen as a natural, wholesome food, something we trust to sweeten our tea, drizzle over warm toast, or stir into a soothing cup of lemon water. For centuries, honey has been celebrated for its golden color, rich flavor, and even its supposed healing properties. Many people reach for honey as a comforting remedy for coughs or sore throats, believing it to be a safe and gentle choice for the whole family. It's a staple in kitchens around the world, used in everything from breakfast to bedtime drinks, and often recommended by grandparents and home remedy books alike to soothe a sore throat. But for infants under 1 year old, honey can be dangerous, posing a risk that many parents and caregivers may not realize. The hidden danger comes from invisible spores of a bacterium called Clostridium botulinum. These spores are impossible to see, smell, or taste, and can be present in both raw and processed honey, regardless of how pure or organic it may seem. Bees can carry these spores from soil and dust into their hives, contaminating the honey during the natural process of honey production. Even the most careful beekeeping cannot guarantee honey is free from these spores. While adults and older children have mature digestive systems that can safely neutralize these spores, infants' immature digestive tracts cannot. Their bodies lack the necessary defenses to prevent the spores from growing and producing toxins. In babies, the spores can germinate and produce botulinum toxin, a powerful neurotoxin that causes infant botulism. This rare but serious illness can lead to muscle weakness, poor feeding, constipation, and even life-threatening breathing problems. The scary part is that it only takes a tiny amount, sometimes just a single spoonful or even a taste of honey, to put a baby at risk. Symptoms can develop slowly, making it hard for parents to recognize the danger right away. Medical professionals like Dr. Baibing Chen have repeatedly warned about this risk, yet many parents remain unaware. Pediatricians and health organizations around the world stress the importance of keeping honey away from infants, but the message doesn't always reach everyone. The solution is simple: never give honey to a child under 12 months old, in any form. This rule applies to all types of honey, whether it's raw, organic, pasteurized, or blended into foods. This includes honey in baked goods, cereals, and even foods that might only contain a small amount of honey as an ingredient. Always check labels and recipes carefully. It also means avoiding honey as a home remedy for coughs or colds in babies, no matter how natural or traditional it may seem. The rule is absolute, no exceptions. Even a small taste can be enough to cause harm, so it's best to be vigilant and err on the side of caution. For adults and older children, honey is a safe and delicious treat, full of flavor and tradition. But for babies, it's a hidden danger that's easy to overlook. A single spoonful can turn a natural treat into a medical emergency, leading to hospital visits and serious health consequences for your child. Protect your baby by keeping honey off the menu until their first birthday. It's a simple step that can prevent a rare but dangerous illness, and give your child the safest, healthiest start possible. Infant botulism is a rare but serious illness that can begin with symptoms so subtle they're easy to miss. Parents might first notice their baby is constipated, or that their usual strong cry has become weak and faint. Feeding may become difficult, as the baby seems less interested or struggles to suck. These early signs can be mistaken for common baby issues, but they are the first clues of a much more dangerous problem. The real danger lies in the way the botulinum toxin works. It blocks nerve signals to muscles, causing progressive muscle weakness. As the toxin spreads, it can lead to paralysis, affecting the baby's ability to move, eat, and even breathe. This is why infant botulism is considered a medical emergency. As the illness progresses, babies may become noticeably floppy, losing the ability to hold up their heads or move their arms and legs. In severe cases, the muscles that control breathing are affected, making every breath a struggle. Without quick intervention, the consequences can be life-threatening. The culprit is often hidden in plain sight: honey. The spores of Clostridium botulinum are incredibly resilient, able to survive in honey's sugary environment for months or even years. While harmless to older children and adults, these spores can germinate in a baby's immature gut and produce the dangerous toxin. Even a tiny amount, a fingertip's worth of honey, or a taste from a contaminated spoon, can be enough to cause illness in an infant. It doesn't take much for the spores to find their way into a vulnerable baby's system. If a baby shows any signs of muscle weakness, poor feeding, or trouble breathing, immediate medical attention is critical. Early recognition and prompt treatment can make all the difference in recovery. Treatment usually involves hospitalization, sometimes in an intensive care unit where the baby's breathing and vital signs can be closely monitored. Doctors may administer an antitoxin called Big V, which helps neutralize the toxin and speed up recovery. With fast, expert care, most infants recover fully, though the experience is often long and emotionally draining for families. The road to recovery can take weeks, but hope and healing are possible. Remember, the risk isn't about how much honey a baby eats, but whether the spores are present. Even a trace can be enough to trigger illness in a child under 1 year old. The message is simple and urgent: never give honey to babies under 1 year old. This small precaution can prevent a devastating illness and save lives. Always check ingredients, avoid honey in any form, and make sure everyone who cares for your baby knows the risks. Protecting your child can be as easy as making this one change. Share this knowledge with friends, family, and caregivers. Together we can protect the youngest among us from this silent threat. Doctors like Dr. Baibing Chen have seen firsthand the heartbreak caused by infant botulism. He's treated babies who became critically ill after a well-meaning parent gave them honey to soothe a cough or help them sleep. One case involved a baby who needed intensive care and mechanical ventilation to survive. The parents were shocked. They had no idea honey could be dangerous. These stories are not rare, and they're almost always preventable. Medical professionals often have to connect mysterious symptoms to a simple exposure days earlier. Their warnings are based on real tragedies, not just statistics. When doctors share these stories, the risks become real and urgent. It's not just about honey. Everyday actions can have unexpected consequences. These narratives turn medical advice into life-saving lessons. Awareness and education are the best tools to prevent needless suffering. Sharing drinks at parties or festivals feels friendly and brings people together, but it can also expose you to dangerous germs you might not even realize are there. When you pass around a bottle or sip from the same cup, you're not just sharing a drink, you're sharing whatever's in your saliva too. Viruses and bacteria in saliva can cause severe infections, including meningitis, which is an inflammation of the membranes that protect your brain and spinal cord. Even if someone looks healthy, they could be carrying germs that are easily passed on through shared drinks. Meningitis inflames the protective membranes around the brain and spinal cord, leading to serious symptoms like intense headaches, fever, neck stiffness, and confusion. In some cases, it can cause seizures, hearing loss, or even permanent brain damage. Germs spread easily through shared cups, bottles, or utensils, especially in social settings where people are close together and not thinking about hygiene. Dr. Chen recalls treating a young adult who developed viral meningitis after sharing drinks at a festival. The patient had no idea that a simple, friendly gesture could lead to such a serious illness. What started as a mild headache and nausea quickly escalated to seizures and an emergency hospitalization. The speed at which symptoms worsened was shocking to everyone involved. Even viral meningitis, though often less severe than bacterial, can have lasting effects like memory problems, fatigue, and difficulty concentrating. Recovery can take weeks or even months. Bacterial meningitis is even more deadly. 1 in 10 people may die, and survivors can face lifelong disabilities such as hearing loss, brain injury, or the need for ongoing care. The simple act of sharing a drink can have life-altering consequences, turning a fun night out into a medical emergency that affects you and your loved ones. In crowded environments, germs spread fast, and it's easy to forget about the risks when everyone's having a good time. Think twice before sharing. Your health is worth more than a moment of convenience or a quick sip from a friend's cup. Protect yourself and others by keeping your drinks to yourself. It's a simple choice that can prevent serious illness and keep your brain and your life safe. Meningitis is more than a headache, it's a medical emergency. It can be caused by bacteria, viruses, fungi, or parasites, and symptoms often mimic the flu at first. Watch for high fever, severe headache, stiff neck, and sensitivity to light. A rash that doesn't fade under pressure is a red flag for bacterial meningitis and requires immediate help. Bacterial meningitis can kill within hours if untreated. Viral meningitis is usually less severe but still serious. The illness spreads through close contact, coughing, sneezing, or sharing drinks. Early recognition and medical care are critical for survival. Good hygiene and vaccinations are your best defense. Dusty attics, basements, and sheds can hide more than just clutter. They can harbor dangerous fungal spores. Fungi like Histoplasma capsulatum thrive in soil with bird or bat droppings. Disturbing these areas releases spores into the air, which can be inhaled without notice. Most healthy people recover from mild exposure, but those with weakened immune systems, or anyone inhaling large amounts, can develop severe infections. These infections can spread from the lungs to the brain, causing life-threatening diseases. Wearing a high-quality mask like an N95 is a simple but vital precaution. Protect yourself before tackling dusty spaces. Your brain will thank you. Fungal infections like histoplasmosis can take months or years to reveal their true danger. People often dismiss early symptoms, cough, fever, fatigue, as minor. Later, severe headaches, confusion, and memory loss may appear as the infection spreads to the brain. Diagnosis is difficult, and by the time it's found, damage may be done. Treatment is long and challenging, and even survivors can face permanent neurological problems. The mortality rate for severe cases is high. Many victims wish they'd known the risks of cleaning dusty spaces. Awareness and simple precautions can prevent these hidden tragedies. New threats to brain health are emerging, like the raccoon roundworm, Baibing procyonis. This parasite's eggs, found in raccoon feces, can contaminate soil, sandboxes, and even wild berries. Children are especially at risk if they ingest contaminated dirt or objects. Once inside the body, the larvae can migrate to the brain, causing severe, often fatal inflammation. The parasite has recently spread to Europe, prompting new public health warnings. Avoid contact with raccoons, wash hands after outdoor play, and don't eat low-growing wild berries. Simple precautions can prevent a devastating infection. Stay alert to new risks as our environment changes. Protecting your brain doesn't require drastic changes, just smart, informed choices. Never give honey to infants under 1 year, in any form. Don't share drinks, bottles, or utensils, especially in crowded places. Teach children not to share food or drinks at school. Practice good hygiene. Wash hands often. Wear a mask and gloves when cleaning dusty or dirty spaces. Check ingredient labels for hidden honey in baby foods. Avoid contact with raccoons and wash hands after outdoor activities. Stay up to date on vaccinations.